I think the biggest issues, mental health issues that are facing girls is trauma. Girls are experiencing trauma at significantly higher rates now than ever before, and trauma includes not only child abuse, sexual assault, but also the effects of domestic violence, witnessing domestic violence, the effects of the economy, and losing a home is definitely traumatic for girls. Changing schools, all of that kind of socioeconomic factors are affecting girls at much higher rates than in the past. Mental health issues that girls face aren't as accessible. For example, there's not very many child psychiatrists here in Jacksonville, and so the wait list for a child needing to see a psychiatrist is at least 3 to 4 months. So if a girl needs, any kind of psychiatric care, it's much harder to get. There aren't the preventative type programs for girls in this community. There's also, while there are resources and they are collaborating a lot more now, access to these resources is often challenging. With transportation, with Jacksonville being such a large city, getting to appointments, the hours of operation for children's mental health is, 9 to 5, Monday through Friday. Well, that's when they're in school and parents are working. And so trying to get a child to services is not only a challenge, but then you have to take them out of school and they have to miss, hours of educational time. And so there are resources, but I think they are limited, and I think that they're difficult to access. Schools are working partnered right alongside the nonprofit social service agencies. You have full service schools, which is one of the best models for providing services to our children. They are located on the school property. Therapists, behaviorists, case managers are all working together with the families, and they also bring in other programs to help the children with all the needs that they might have that might interfere with their success in school. You've got the after school programs, the team up programs, the mentoring programs that have come into the schools. And so I think that nonprofits kind of knocked on the school board's door, and the school board answered and is allowing programs into the schools, even though I know that educational focus tends to be on the FCAT and succeeding educationally. I think that the schools have realized that if we don't start knocking down some of the barriers to a child's success, it's not enough to just teach them. You've got domestic violence issues going on at home, which could affect a child succeeding in school. You've got truancy, you've got substance abuse, you've got all kinds of things going on that if we don't work on those issues, a child's never going to be successful, no matter how high of a level of education we try to provide for them. So schools and the community have really partnered. The Student Health Advisory Council reviews programs and provides approval for programs to go into the schools. We have a bullying program that we are now allowed access into all public schools in Duval County to be able to work on some of the issues. We know that there's a high truancy rate due to bullying, and so if we can provide programs like that into the schools to help reduce some of the effects that will impede a child from succeeding in school. So I think schools and community agencies are just working alongside each other, which is fantastic.
Bullying has different elements. You can bully physically, you can bully emotionally. So the relational, the social type of bullying is more prevalent with females. And although we hate to make the distinction between the genders, we do want to understand the way that we interact as females or as males. And it does make a difference. And we do see a lot more bullying that is relational, social, emotional with young girls. Why does it seem that young girls in middle school and high school bully more? It's because social media is social. And not to say that men aren't social, they are. Nobody wants to hear a conversation in a boys' locker room. But it's to the same effect. They have the capability to hurt more, to gain more attention, because they can reach hundreds, thousands, millions of people online so they have a larger audience and they can gain more power. Because all abuse is about power and control, this tool is being used more and more for abuse. Socially, that's what this is. This is a social media website. With youth, it's important that their first resource is the school. Their interactions, their social circle, their social culture is going to be with their schoolmates. That's who they interact with, not only at school, but at home, online. So that's their circle. That means that schools need to be, or have a protocol that's going to be a resource. Second is, of course, parents. And you can say that's first, but the reason I wouldn't say that's first is because the youth does not report stuff to adults. They're not going to report abuse to adults because they don't feel, A, that they're going to do anything about it, or that they can. They don't have the capability. You can't stop this person from hurting me, and that's the usual response that I get. And, of course, they don't want to feel the discipline of saying, well, I'm being bullied by text or on a website or by tweets, and they don't want their phone to be taken away. So yeah, with smartphones, and they just don't want to have the disciplinary action that they feel is coming if they do report it. So it's important that parents make it clear that they're not going to take disciplinary action yet, especially because they're the victim, they're not the perpetrator. I feel that most schools have protocols to address bullying and cyberbullying. I do feel that it's new to the schools. I feel that it is new for the teachers to follow through on the protocols. The teachers need to be empowered, and the protocols are going to need to be tweaked. And I do feel that there is some work that's going to need to be done to the current protocols. And they're learning, just as everybody is learning. But we need to take it seriously, especially when the bullying is addressed gender-specific, race-specific, sexual orientation-specific.